president's speech
to
last
repeal
night,
it 47 times.
that visit today to
Do you think
Uniontown,
that's where the Republicans
what are you
still
looking
are,
to
or
see?
they've moved on to a new position on this now that so many people are actually getting the program?
Well, first, I think the effort to repeal it was a fool's errand. But let's just start.
So what should happen?
Well, let's start with the reality that when Obamacare was being discussed, the insurance companies rushed in to protect the status quo, which is 50 state-regulated oligopolies. The health insurance companies have never been subjected to real competition. They fear real competition, and they have gotten built into this law 50 state-regulated oligopolies. The only force known to man that improves quality and lowers cost at the same time is what? Competition. We don't have it. And we don't have it in Obamacare. And add to that,
We didn't have it before Obamacare.
We didn't have it.
Even worse.
That's right. And Obamacare, because the prescription drug companies and the health insurance companies helped write the law. In addition to that, we have a law that is longer than the Harry Potter novel, with 2,000 pages of regulation
Does that mean
attached
it's
to it.
bad?
It
Length
means
equals bad?
complexity kills.
Complexity is bad?
Yes, complexity is bad because
Whoa,
what we've
there's a quote.
complexity
is bad.
Yeah, it is, because people can't administer it. So now you have an uncompetitive
The world is
situation.
complex, Carla, you know that.
Yes, it is complex. It absolutely is complex, which is why, if you want to talk about global warming, for example, you've got to go all the way into the science and what they say
Let's wait
about...
till Willie comes out.
The point is, I fear this isn't going to do what it's intended to do, and then we're going to have to find an alternative.
Would you agree with that?
No, I wasn't a big fan of this bill because I think we should have had a public option on Medicare for all. It was a whole lot simpler. But this.
By the way, single payer would be more effective than what we have today.
Absolutely.
This bill,
So,
right.
I don't agree with that, but it would be more effective.
This bill has worked in Massachusetts. I'm going to defend it just on the merits because I didn't agree with the bill, but it can work. It did work. 98.5% of all the people in Massachusetts have health care because of Mitt Romney and Romney Care, which is essentially the same as Obamacare. Now, the problem is that it is, not only is it complex, but as Carly pointed out, there has never been much competition between insurance companies. They did, in fact, write the bill. Right. Their staff people actually wrote the bill. Went on Baucus' staff, wrote the bill, and now back in the private sector. That is true. The real problem here is that nobody has addressed the fact that we get paid, we doctors get paid to do as much as we possibly can, whether you need it or not. And we get paid to do that.
Isn't the real gougers the hospitals? It's not the insurance companies.
That's
the pharmaceutical companies and the hospitals, which are now merging, which is going to make it even worse.
The insurance companies and the hospitals are merging.
And the hospitals with each other. They're the two biggest ones. I think they're called Community Health Systems and Health Management Associates. A group called National Nurses United did a study recently. 14 U.S. hospitals charge more than $1,000 for every $100 of their total costs. Certainly, this is not the invisible hand.
No, what should have happened is...
It's not the invisible hand. I totally agree. And part of the reason hospitals overcharge some is because they can't charge anything to others. That's part of the problem we have with our healthcare system today. That
The big
I
problem
fear
is
Obamacare hasn't
we pay by the procedure. If we paid by the patient, this problem would be solved. We'd have doctors getting paid to keep people healthy. Right now, we get paid when people get really sick. This is insane.
and we haven't fixed that problem with Obamacare.
But
We
Obamacare
agree.
is doing some
We
good
agree.
things about these things. For one thing, it is changing some of the payment models for the doctors and hospitals to pay them more for outcomes rather than for what they're doing.
Right.
And then the other thing it's doing is, in the individual states, there's been tremendous pressure put on the insurers to keep premiums down. And the way they've done that is by going to the doctors and hospitals and saying, we're not going to pay you as much for these exchange plans. Some of the hospitals have opted out. Here in Los Angeles, none of the plans available through the California Exchange include Cedars-Sinai, which is one of the highest-end hospitals in LA. And people look at that and they say, I don't like this plan, it doesn't have Cedars-Sinai. But this is actually the way we can get to the hospitals and say, you're not just allowed to charge whatever you want that will pay the bill. The insurers are starting to say no. And that's starting to turn into healthcare cost savings. In 2012, we actually had the first year that the share of the economy that goes to healthcare spending declined on record. So not all of the slowdown in healthcare spending is due to Obamacare, but there's been some of it. We need more cost control, but the law has actually been somewhat effective in getting it exactly what you're describing.
Okay.